Well, good evening, and thank you for joining us this evening on another Hallelujah Diet webinar. We have another exciting presentation for you, bypassing the bypass operation. Heart disease is such an important issue, and so many people are dealing with it. And this is a real exciting presentation that Dr. Donaldson will be bringing to us, and we're just real excited to have him with us and to be able to share that. Before we get into that, though, I'd like to just do a couple of housekeeping. I'm Paul Malcolmus. I'm President and CEO of Hallelujah Diet, and we really appreciate you joining us tonight and look forward to sharing the information. As we get started this evening, I want to remind you that if you have any questions, simply type them in the comments question box down there, the chat on the bottom left-hand side, and we'll see those and queue them up for Dr. Donaldson as we get through the presentation. Also, if you stay with us through the evening, which will be about 30 to 45 minutes, we'll do a drawing at the end for 3 lucky winners of a 3-month supply of one of the products that we'll be talking about this evening. So you'll have your choice, and customer service will reach out to you and be able to help you select which product works best for you. Before we get started, I'd like to open us in a word of prayer. If you pray. Dear Lord, we just thank you for this evening and for the opportunity to be able to share this information, Lord. We pray that you'll provide coverage over all of the technology and give Dr. Donaldson the words to speak, Lord, that we honor you through it and that somebody will be helped through the information shared. In Jesus' name we pray. Amen. Well, Dr. Donaldson's been a part of the Hallelujah Diet team since 1998. He came on as the Director of Research, and he's been an invaluable asset to the science behind the Hallelujah Diet. He's a chemical engineer graduate from Cornell University and is now the research director for the Hallelujah Diet. His work consists of designing and coordinating clinical intervention studies based on scientific symptoms or disease and focuses on the results of the Hallelujah Diet. He is also the author of many research papers and studies that highlight the benefits of adopting the diet. Dr. Donaldson's research is ongoing, and he plays a vital role in new product development and innovations. And it's been a privilege to work with Dr. Donaldson all these years, and it's a real privilege to have him on the call again this evening. And Dr. Donaldson, welcome, and thank you for joining us.
Thank you, Paul, and want to welcome all of you who are listening in tonight, and those who maybe not hear it right away but are going to hear it later as well. Welcome. We're talking about bypassing the bypass operation. It's a coronary artery bypass graft. It's pronounced cabbage. That's the surgery, or cabbage the vegetable. We get to look at, which one of those you want, the benefits and risks of each of those. A few months ago, I wished I had this information together just the way I have it tonight for you. I had a friend that was considering doing a bypass operation, and I gave him some information, but it wasn't nearly as well presented as this is tonight. So I hopefully this will be beneficial to you. Either you know someone that is considering a bypass operation, or maybe you yourself are in need. So I hope this information will be valuable to you. So what we want to do is kind of look at the benefits and risks of doing the cabbage surgery. Is it effective? Is it safe? And compare that to diet and lifestyle interventions. Are they effective? Do they actually work? And are they safe? And which has the best profile and the best way of going forward here? But before we look at that, we want to give an idea of what it looks like. What kind of numbers we're looking at here. If we look at the red line here, this red line across here, this is the number of bypass surgeries that have been conducted over the years. So about 95, it peaked at 600,000 per year in the U.S. And it's come down a little bit. It's only 400,000 now. So that averages out to what, 1,000 at every calendar day or so in the U.S.? The green line is for stents there, the percutaneous coronary interventions there. And they have just as many of those as well. And catheterizations, when they go and they put some dye into your arteries to examine your heart, 1,000 of those done every year. That's 1 million of those done. So lots of operations are being done. It's very common. Very common. It didn't start until about 1980 or so. Late 70s, they developed this technology, and it's been seen. You probably know someone that's had a bypass operation, and it costs a lot of money, of course, here too. And it's, if we go to the next slide here, and we can see it's like $200 billion here. Just a second here, we've just a little bit stuck. Okay, here. So we can see we've got, about $200 billion in heart disease overall. And, break that down into hypertension, strokes, and other cardiovascular disease as well. But the big number is $200 billion. I'm not sure how many that works out per surgery here. It's over 50,000. I've seen one number of 75,000 per pop for doing this. There's a hospital about an hour away from where I live, and they do 400 of these every year, a couple doctors between the two of them. So that's a lot of surgeries. That's a lot of surgeries. So exactly what is a bypass operation? All right, so you see there's a team of doctors working on you. Over here, a team of doctors is anesthesiologists you can't see working back behind the head there. And they put you under with general anesthesia. They could open your sternum, your chest bone, with a saw. So open it up, they chill you down a little bit. You may be put on a heart-lung machine, unless they can do an off-pump procedure, which it's a little less risky to do an off-pump if they can. And they have to get a graft from someplace. They can take a vein graft from your leg, and there's a couple ways to take that out. They do it endoscopically mostly now if they can. They can take an artery from your chest wall, figure out, well, you don't really need it over there. We can put it on your heart, and you do okay. It's better than nothing, I guess. The arteries tend to last longer than the veins as far as functioning goes. And they can also take an artery from your inner arm. So they sew that graft into the aorta, and then they stick it back into the side of the heart around, and they bypass that section of artery that's plugged up. And then they start to warm you back up, make sure the grafts are all functioning, blood is flowing, the heart is pumping again. They sew you up, they try to fight hard against potential infections. Some of the worst germs in the hospital live in, some of the worst germs in the world live in the hospitals themselves. And try to prevent complications. And then they move on to the next patient and do it again and again and again. So they do a lot of these. But it's a very invasive procedure. You think of having your sternum cut open and then wired shut when you're all done, and having a retractor there just holding your chest open when you're doing this here. So the first question is it effective here? Is it effective? We'll talk about whether it's safe or not later, but let's look at whether it's effective. And the literature, there's been studies saying, well, it is slightly better than doing nothing or just using medications. And you do get real relief of the chest pains, the angina that you have. Sometimes, though, even if the grafts fail, you still get relief of the angina. Okay, it still happens. In a series of 23 patients that, they'd done the bypass grafts, and they'd all failed over time. 12 of them still had significant improvements. 5 of them didn't even have any symptoms. 13 of the group there, of the 23, had improved exercise capacity. So here they were getting some good results even though the grafts had failed. And there's a couple of reasons for that possibly. And part of that is probably from the collateral blood flow that we'll talk at the end here. So there's 3 studies that were done early on when they started doing these in the 80s, and they followed some people, mostly men, and wanted to figure out were these worth doing or not. And they concluded basically on these 3 studies that yes, it was worth doing for really sick people. But they start with men here, almost 800 men that had mild or moderate angina. That's the main symptom for doing this really in the early years. You do a stent, or you do you look up into the vessels of the heart and see if they're blocked or not now with your catheter. I don't know if they did catheters then or not, but they would look and see if you needed to have a surgery or not. And they found that for people with mild disease, they didn't really get much benefit from it. There was a bit of a benefit for those who need like a triple bypass or a quadruple bypass, or the main left anterior descending artery. If that was plugged in a certain area, then, over 5 or 8 years, they did have some survival benefits there. It wasn't huge benefits, but it was better than doing nothing. And that was in Europe. Here's another study where they followed almost 800 patients over 10 years. And they started with patients that just had mild angina. And here, this is interesting. It says the 5-year probability of remaining alive and free of a heart attack in the patients that just used medicines, it was 82%. Some of those went on to have some surgery as well, but they didn't survive any better even if they had. And 83% of the patients that were assigned to surgery were alive and free of heart attacks in 5 years. So they concluded that the coronary bypass surgery appears neither to prolong life nor to prevent myocardial infarction in patients who have mild angina. So if their solution is, wait till you're really sick, and then we can do a surgery on you. Okay, one more study here. The Veterans Affairs Cooperative Study, looking at people with stable angina here. And it followed them for many years here. And the conclusion is really interesting here. It says the benefits of coronary artery bypass surgery on survival, symptoms, and post-infarction mortality were transient and lasted fewer than 11 years. So if you do this on a guy that's like 45, 50 years old, by the time he's 65, he's going to need another one. So the benefits begin to diminish after 5 years when graft closure accelerates. Surgery is effective in reducing mortality only for patients with a poor natural history. So if you're really sick, it helps you a little bit. Low-risk patients who had a good prognosis with medical therapy derived no survival benefit with surgical therapy at any time during the follow-up period. Regardless of risk, surgery also did not reduce the incidence of myocardial infarction or the combined incidence of heart attack or death. This is a study, one of the studies that's used to say that you should use this cabbage surgery to help people. So, what do you think, based on those 3 studies and what else you know, is this surgery effective? Go ahead and pick one of those ones there, and we'll go forward after you fill in there. And some of you are still voting and thinking about it here. You're about half of you are done now. So say, well, it depends on how sick you are. That's some of it. Maybe some of you need more information. Some of you say just right out, well, it's not effective. Okay. Well, the next question is it safe? Okay. So a couple more of you vote here. But some of it either it's not effective or it depends on how sick you are. That's going to, if you're really sick, well, if you need a quadruple bypass, maybe you get some benefit from doing that rather than just taking some medicine. Of the things that they can offer to you. Now let's talk about the risks of having cabbage surgery. There are risks of things happening right during the surgery itself. It's not everybody. It's less than 10%, but it's not 0 either. There's complications after surgery too. Okay? If you take this vein from the leg, those veins tend to close up as grafts. Within 5 to 7 years, half of them are closed. 85% of them are closed within 15 years. So it turns out the people that are sicker are more likely to benefit from the surgery, but they're also more likely to have complications due to the surgery itself as well. So it's kind of you kind of have to weigh that a little bit. Are you too sick to actually have a surgery itself? So there's some complications that show up in the surgery here. Bleeding, that have to go back in and do more surgery. Heart attacks actually happen during surgery. heart failure, heart arrhythmias, strokes. Some of that plaque gets dislodged, goes into circulation, goes up into the brain. That's not good. You may end up with some brain fog and depression. Happens as well. Some of that is temporary. You may have troubles with lungs. You may get infections in the wounds where they cut you open. Your kidneys may fail. Usually it's temporary. Sometimes it isn't just temporarily. And you may also die from this. There was a study done in Europe, in Austria, at this medical university, and they compared complications from the cabbage surgery for the first-time patients with those who had already had a stent in place before. And they compared them for risk-matched groups here. So it's interesting here just to look at the complication rate for both of these. Mortality during surgery here. All right, those who already had stent, this is 4%. That's 4 of every 100. If it's the first time you've gone in, it's only 2%. That's 2 of 100. But that's 20 of 1,000. Of 100,000 people, that's 2,000 people dying from surgery itself. Okay, now we're having about 400,000 surgeries of these in the U.S., and the rates maybe differ a little bit from this, but people die from these surgeries as well. It's not unheard of by any means. And there's a possibility of major adverse cardiac events, having a heart attack right on the table itself and dying there. Bleeding complications, needing blood products added back to you, and kidney failure, and even having to need your kidneys replaced as well. Those aren't like, 1 of 1,000 kind of percents here. These are several of every 100 that have serious adverse events during the surgery itself. And right, the sicker you are, the higher the odds are of having an adverse event as well. So it is a bit risky. It is a bit risky. What do you think? Do you think it's safe? Is it worth the risk? Do you think the risks outweigh the benefits? Maybe it's safe under some circumstances. You literally put in your hands in your doctor. So maybe if it's a really good doctor, I should go ahead and tell me what you think about this. It might give you pause a little bit if your doctor told you the complication rates just like this. So if we look at the results here, looks like most of you want to figure out, well, what are my options? If this is the main therapy, what are my options? And some say, well, maybe under some circumstances, if I've got a good doctor and I really trust him and I'm in pretty good health, maybe I can make it. But not many of you are actually saying it's really worth the risk in itself. And really, from my point of view, it looks like we're just kicking the can down the road. You've got a can of poor health, and the surgery is just working with the symptoms. It's not working with root causes at all, and you're just kicking that can of poor health down the road. As you go down the road, you're going to find that can again, and you're going to have to figure out what to do with it. Do I kick it again? Can I kick it again? What do I do long term? I need to do something different here. So, alternatives, are they effective? Are they safe? What can you do? But before we look at alternative therapies, we need to ask a little bit about, why do people get heart disease in the first place? In this very large study here, the Inner Heart study, they figured out these 9 factors were really the reasons for 90% or more of the risk. You can look for exotic things and so on, but really when it comes down to it, if you measure these 9 things, you'd see it's smoking, abnormal lipids, and they measured, this ApoB over ApoA1 ratio. If those are off kilter, so is your cholesterol. Hypertension, diabetes, obesity, psychosocial factors, the locus of control, that's just being a victim as compared to taking control of your own life, and low consumption of fruits and vegetables, high consumption of alcohol, and low rates of regular physical activity. Those things are all modifiable. Every last one of those can be modified by changing your diet and your lifestyle. So what we're saying here is that 90% of the risk of having a heart attack can be controlled by your diet and lifestyle. But if you do what you've always done, you're going to get what you've always gotten. I didn't come up with that. I think Reverend Malcolm said that years and years ago, and it's still true. If you keep on doing what you've been doing, you're going to get what everyone else has gotten, doing the same thing you're doing. But it has happened in other countries. You know, they've done large studies. You start with 20,000 men, follow them for 11 years in Sweden, and then look at the low-risk group. They found the 1% of the group that was the healthiest. And you can see how they define healthy there. It's pretty reasonable. They found if you took the rates of heart attack in this 1% and extrapolated it over the 20,000 men there, they would have prevented 4 out of every 5 heart attacks. They've had only 1/5 of heart attacks that they would have had. And there's improvement even that you could have done here as well, I'm sure. But even in that group, they could have prevented 4 of every 5 heart attacks. That's pretty amazing. Okay, it's not just 50%, it's not like 20 to 30% decrease. It's 80% decrease. Iceland, I don't know how many of you are aware of what's gone on in Iceland during this time. Back from 81 to 2006, they decreased the rates of death from heart disease by 80%. Only 25% of that decrease was due to medical interventions, either surgery or medications. A full 3/4 of it was coming from risk factor reduction. You can see the risk factors here, and obesity actually increased and the rates of diabetes increased during this time. If those hadn't gone up, it would be closer to another 10% decrease. So you'd be up to about 90% decrease of death rates there. And most of it due from reducing these factors right here. So yes, it can be prevented here. Another study looking at 250,000 people, and they measured the risk factors several times over the life, and they're looking for lifetime risk of heart disease and dying from it. So here, if you had a low-risk profile, pretty reasonable, total cholesterol, you didn't have to measure all kind of fancy things, just total cholesterol less than 180, blood pressure less than 120 over 80, just keeping it normal, not smoking, not being diabetic. Look at this risk. And for men, going from 37.5% to 3.6%. That's, and women, less than 1%, as opposed to 18% risk, over your lifetime of having a heart attack. That's amazing. And, people are dying from this needlessly. They're really needlessly dying of this heart disease. Okay, so these population-based studies, they show you that this can be prevented. But how about reversing heart disease? So let's move to that next part here. Now, Dean Ornish started working in this area, in this field. Now, before the mid-90s, he was publishing his results in the mid-90s here. Okay, so he started the small group. He started first with just a group of 28 in the experimental group and 20 people in the usual care group, and they just had medications and they did try to do a few good changes. When they measured all the lesions in the heart, okay, all the smaller ones to the ones that were really plugged up, and this is using angiograms. Here they saw regression. Average was going from 40 to 37 per 8, and here they saw progression, getting worse from 42 to 46%. Over 2% increase there. If you measure just the lesions that were more than 50% plugged initially here, you're getting a decrease from 61 to 55%, almost 5% decrease, an absolute decrease. And here, you're going to increase, progressing here. And angina, look at this. The ones who were, that was the reason for coming in for treatment in the first place, because you had so much chest pain, you couldn't do anything. 90% decrease in frequency, duration and intensity also decreased, and here they're going up. It's getting worse in this group under usual care. And this is after 1 year follow-up here. Now, after 5 years, they followed the same people. Not all of them followed through. 15 of them were in the control group and 20 in the treatment group here. Well, so here's the degree of stenosis here. Diameter, it was going down in the treatment group, and here dramatically increasing over 5 years here. And that average stenosis became over 50% rather than just 40% in the beginning here. The ones who stuck with it got the best results. If you didn't adhere to the program, you kind of stabilized. But the ones who really applied themselves, degree of stenosis changed almost 7%, absolute 7% here. So seeing very good results here. This was the first time it was shown that you could actually reverse heart disease. It's not such a uncommon thing to talk about someone reversing heart disease now. But in the mid-90s, it was unheard of. So this was groundbreaking research for sure. It was also demonstrated in a 12-week program. Now, if you have a cabbage surgery, you get your chest split open, it's going to take you several weeks to get back on your feet and get going again at full speed here. So you could change your diet and lifestyle in 12 weeks, going from having an angina here. Not everyone that was in the study here had angina, but of those that did, 74% of those were free after just 12 weeks. And 9% more moved from limiting to mild angina. So that's as good as getting a stent, really, in just a 12-week process here. And he found out, yeah, instead of just trying to recover from a surgery, they already had improved exercise capacity, less depression, and better health-related quality of life. So it was working good. It worked good for 12 weeks. Now, he tried to work with insurance companies and get them to cover. So they did a longer study, more patients here. And they found over a 3-year period that 77% of the people avoided revascularization, either stent or cabbage surgery, for at least 3 years. And as long as they kept on the program, they were going to avoid those revascularizations. And they found the reduction in angina was just comparable to stents as well, or having bypass surgery. There was fewer cardiac events as well in the people that were having the lifestyle changes compared to those who had the stents and the surgery. So it was safer. It had as good of results in terms of reducing angina and avoiding procedures. So it was a win for the insurance companies as well. And they started to cover the lifestyle intervention program of Dean Ornish. Now, Dr. Esselstyn here is a good guy. Very good doctor. And he worked initially with a smaller group, and he followed up with almost 200 patients, followed them for over 3 years, working at the Cleveland Clinic. He found of those 198, 177 of them stuck with the program, 21 didn't. There's one event in this group that was due to disease progression of the 177. There's only and there were 13 events in these 21 people that didn't stick with the program at all. So, huge difference. He was getting very excellent results using his program. And he said this heart disease thing, it's a paper tiger. It looks like it's got teeth, but there's nothing to it, really. There's really nothing to it. You change your diet and your lifestyle, and it's just a toothless paper tiger. So one more question for you here. If a diet and lifestyle change is as effective and it's safer than the cabbage surgery, which would you choose? That means you're going to have to change what you're eating, how you're living. You have to manage stress differently. What are you going to choose? Well, when you put it that way, who's going to choose getting a stent or a surgery? Who's going to choose that, really? If you knew, this is one of the reasons I started doing this kind of research in the first place, because people didn't know really what their choices were. If you could put it to them straight and have people see, well, this is really what my options are. I could get good results really just by changing my diet and lifestyle, then I'm going to do that. I don't want to go through the surgery where they split my chest open. I'm not really interested in that. So, that's the kind of results we're seeing. The question here is, what about the Hallelujah diet? Does it work as well as Dean Ornish's program? Does it work as well as Dr. Esselstyn's program? And we've been working on this diet and optimizing it for 20 years now. I've been working on it for 18 years, and it really is optimized. Not just are you using plant-based nutrition here, but you're using the juice powders of the barley grass. The barley grass juice powder, just a very nutritionally dense product here. And there's some dietary supplements to give you faster, more complete results. We know a lot more than we did back, 15 years ago when they started this research. And we emphasized using raw foods as well. 85% raw, 15% cooked. A little bit of cooked food works well. That's an optimized ratio here. Okay, and some of the supplements that help out, the Barleymax I mentioned, Fiber Cleanse to get you going here, Biocurcumin, the serapeptase, the fish oil, the Pharmax Finest Pure Fish Oil, the bioactive form of B12, B6, and folate, vitamin D3, K2, the nascent iodine. These all have specific benefits for hearts, for cardiovascular health. And some of those are on the cardiovascular kit that we offer for sale, but it works well. You know, this program is going to work as well as what you've seen with the other programs, the plant-based programs as well. Let me give you just a couple stories here. This gentleman said, my heart attack was before I changed my diet. I was scheduled for a second and third angioplasty, but after 5 weeks on the diet and a thorough checkup, they told me I didn't need any more angioplasties. 5 weeks. Just 5 weeks. Here, I've lost over 50 pounds. Waist size from 42 to 36, cholesterol down to 170. Blood pressure 130 over 85 was much higher than that. It still should go lower. Pulse 58. And a lot of other things cleared up too. You know, your heart surgery, if you do that, it's not going to help your knee at all. His swollen knee got better. Ear infections cleared up. Sinuses cleared up. All these other things cleared up as well. Okay? Here's another one. Eliminated their medications. 32 pills a day. 32 pills every day. Yep, got rid of those. Weight loss, 40 pounds, took 7 inches off his waist. You know, he already had bypass surgery and the scar's shrinking. Says, I can't believe that just by changing one's diet, so many wonderful things can happen. And there's more testimonies. If you follow this link here, the Heart and Health Cardiovascular, under the testimony section of our website, you'll see a lot more testimonies as well. Those are just a few, just a sampling. And there's many more. People have gotten better using the program. There's one more thing I want to talk about, self-healing here. The body really is designed to heal itself. You just have to deal with deficiency and toxicity. You know, you need to supply the body with the nutrients that it needs and get rid of the garbage and stop putting garbage into your body. Fill it with good things so your strength is renewed like the eagle. So this is something new that I didn't know about. It's called collateral blood flow. See, the body develops a natural bypass to plugged arteries. There's an extensive network of collateral arteries already. They exist, but not very much blood goes through them. If the need arises, they will actually expand, they'll enlarge, and allow more blood to flow through them. Now, they're kind of small, so they don't always show up on angiograms. You think you just have these 4 main arteries. But you can have actually a very well-developed collateral circulation here. So let me show you a picture of this here. If you just had a heart attack, in the midst of that collateral circulation isn't very strong yet, but it will form. So in this picture here, you see the right artery and the left artery. You see some crosstalk right here in this highlighted section here. Those arteries, arterioles, go right across and feed the other side. They're connected here. Here's a heart of someone who died. They take a model. They take the heart and they fill all the vessels with the substance that shows up and hardens. When they heat it up, it hardens. They can digest the rest of the heart away. And you can see all the blood vessels in the heart. Here's the right artery and the left artery. This is someone that didn't have heart disease. Here in this section C here, there's a blockage in this white circle here. You know, there's not very much, you know, the large artery doesn't go through there, but you see an extensive amount of arteries in here as well. That collateral blood flow works very well. This, you know, when they pumped the solution into the heart, it filled up all of these arteries here. Even with a blockage there, it came around the other way and filled all the way up to the blockage here. So you can see collateral blood flow can be very important here. There's a way to measure this in people here. You put a catheter into a vessel. This is just a sample here. You can measure the pressure on this side. You put a balloon here and block any flow going through the stenosis. The blood has to flow around the other way and through this collateral circulation. And you can measure the pressure on this side as well. So you can measure the differences in those pressures and you get an index number from there. Well, there's a study done with exercise. And they asked the question, can someone increase their collateral circulation by exercise? Can it increase and be enlarged here? And they found, 20 people in each group here. Exercise high or medium intensity, didn't matter. They both worked, either medium or high intensity for 10 hours a week. They found a 40% relative increase in collateral circulation in just 4 weeks. So I conclude from that is if you exercise and you combine that with a plant-based diet, you're not going to need a bypass graft. Your body already has a bypass system built in. God was thinking ahead of time, thinking all these crazy fools, things aren't going to always work right, and I'm going to have another method to get the blood around. Even if you have a plugged artery, there are arterioles. They're small arteries that can feed your heart. Really amazing. Very amazing here. So, it's your choice. You could have the cabbage surgery or the cabbage and the fruits and vegetables. Is the cabbage surgery effective? Only for the most diseased, and even then, it's only a little bit effective. There's no benefits for those with mild angina, and the effect isn't lasting. The cabbage surgery is just kicking the can of poor health down the road a bit further. The problem gets bigger with each passing year. The can doesn't get smaller, it gets bigger. Is this bypass surgery safe? Well, there's serious side effects to surgery, including death, and it doesn't prevent future heart attacks. How about diet and lifestyle interventions? Are they effective? You've seen the results? The relief for angina is just as great doing this. And it treats all your arteries, not just 1, 2, 3, or 4. Right? The results last as long as you stay on the program. Is it safe? You know, the diet and lifestyle intervention is safe. There's fewer cardiac events in the studies in those that do it, the diet and lifestyle intervention. The other group that does the medical intervention has more trouble. And of course, you can still be monitored by your health care provider just to ensure you're making good progress. Of course, that's always a good idea, just to, have your checkups. In addition, there's side effects from a diet and lifestyle intervention. The side effects are all good. You're protected from things like diabetes, arthritis, cancer, osteoporosis, and a myriad of other diseases. That whole book of ICD diagnosis codes, you're protected from that whole book. So the choice is yours. Cabbage surgery or a cabbage vegetable. Bypass or lifestyle intervention. Your cardiologist, he may make it look like there's no alternative to the cabbage surgery. But in reality, really what's going on is there's no alternative to a lifestyle intervention. There's no alternative to better health. Even after bypass surgery, you'll still have to undergo a lifestyle intervention if you want to be healthy. You can't buy good health with bypass surgery. It doesn't work. Okay? I'll say that again. You cannot use a bypass surgery to buy good health. So here, I've given you the information you need to make an informed decision. Maybe the first time you've seen this information. You can use it yourself. You can pass it on to your neighbors, your friends, relatives, someone else that needs this information, that needs a clear presentation of really what their options are. So please consider this carefully and prayerfully, this information that's put before you. Thanks very much.
Well, thank you, Dr. Donaldson. That was great information, and we sure appreciate you putting this together. And I know that it's kind of near and dear to your heart because you had a neighbor that kind of brought this situation to you, which is why you put the presentation together in the first place. So thank you for sharing it. Being here at Howie Diet, we've seen so many people with heart disease and different things really overcome. And I'll never forget this one person who came and 2/3 of his heart was dead, actually. And he changed his diet and his lifestyle. And the doctor was just amazed because he'd never seen a heart rebuild before. And it was just incredible. But we've received so many testimonies over the years of the different benefits people have received from changing their diet and lifestyle. Dr. Donaldson had mentioned a link in there, and to the heart disease website that we put together. It's kind of a landing page, and so we'll make sure we send that link out to everybody. We're missing one item right now in the kit, but we'll make sure that we let you know when that's in and if you have any interest. Also, there's 3 products specifically here: serapeptase, the fish oil, and the biopercamin. And there's a landing page, and you'll see the link there. We'll also paste that link in the comment section here so you can get there as well. But let's see if there's any questions. not seeing many questions in here tonight, Dr. Donaldson. One person asked, what can I do to bring my blood pressure down without medication? Your thoughts on that, Dr. Donaldson?
One thing you can do is using a lot of beets, vegetables that have nitrates in them. That's not like bad nitrates in your water, but that actually produces nitric oxide in your body itself, and it helps relax those blood vessels. We also sell a product called Neo 40 that also helps with that. It helps your body produce nitric oxide in your blood vessels. But the vegetables, and beets in particular, have been shown to be very good for that.
Somebody asked if they have heart disease and they reverse it, will they always be labeled with heart disease?
Well, I would like to think you would think of yourself as someone that has heart disease, not as a heart disease patient. You know, it's not part of your identity so much. It's something you've had, but it's really more reversible than a lot of other things. You know, some things you just have to stay with it, and kind of it just, you know, you slip a little bit and it shows up again. But heart disease, you know, it really is a paper tiger. You can reverse it and it goes away. And, you know, you can do everything, call it what you want, but you can do everything you want it to do. You know, your heart rebuilds.
It does. See, somebody asked if, was there, somebody asked what Neo 40 was. I think that was
there's more information on the website on that.
Okay. Will this also reduce plaque in the arteries?
Right, in the carotid arteries going up to the head. Yeah, you know, they don't really do surgeries on that. Well, I guess they do actually. But this will help. You know, you're not just treating one artery when you do it the natural way. With a diet and lifestyle intervention, it fixes all of them.
Somebody asked, what if the husband has a heart attack and has to be rushed to the hospital and the doctor tells him he has to have bypass surgery right away? That gets into some tough situations.
Yeah, I can't say really, you know, what would you do in that case? You know, if they can do something that just to get your heart stabilized for a while without that surgery, within a couple of days, that collateral blood flow is going to kick in, and you're going to start feeling better. And if you really change your diet and lifestyle right away, you know, and that's where you do the intensive diet program here. And, you know, that might work. But that's, you know, that's a very individual case, and you really have to go through that very carefully. But they, you know, I know the medical field, they're very pushy about things like that, and they're their authority, and you're in their space when you go to the hospital.
Yeah.
So you don't have as much. They don't give you much time to think or pray either.
No, they do kind of rush into the situation. Well, that ran out of time, Dr. Donaldson. We sure appreciate all your information. I posted a link in the chat to the cardiovascular support system, and so feel free to follow that link, and there's a lot of information on the diet and the program for people. So lots of good things there to go take a look at. But we sure appreciate you joining us this evening, and look forward to the next month's presentation. It's the first Tuesday in October. It's hard to believe October's just around the corner. But we're glad that you joined us today. Thank you, Dr. Donaldson, for a great presentation, like always, and such good information. We appreciate what you do for us.
All right, blessings to you all here.
Absolutely. Until next month, may God bless you and stay healthy. Good night.